Welcome back, everybody, to the OPT Network. Our guest this morning is Heidi Richard. She is a mom, she is an educator, and she is a self-advocate. She joins us this morning to talk about her incredible story of advocating for herself, her health, and her life. All the way from Boston, Massachusetts, we welcome Heidi to the OPT Network. Heidi, good morning and welcome.
Good morning. Thank you.
Absolutely. So Heidi, you've been a teacher for how long now?
23 years. This is my 23rd school year.
23rd school year. And
Yep.
so on the journey to teaching and getting ready for kids, you start having some health issues or some
I
health
did.
concerns.
Yes. In the spring of 2019, I started getting sick a lot. I started getting a lot of sore throats, swollen glands, some GI issues, things like that. And it continued. I had my physical. They said it was fine. It was probably stress or anxiety.
Mhm.
So,
Did you start to self-diagnose with that? Because those are all
oh,
symptoms that we're all familiar with.
yes, I consulted Dr. Google. I Googled everything. I
Of
diagnosed
course.
myself with like 5 different things.
Uh-huh.
And then it persisted into the summer and the GI symptoms were getting worse. And
Tell us
I
about
called
the
the doctor
GI
again.
symptoms.
I was having a lot of stomach pain in the middle of the night, bad enough that it would wake me up. Like vomiting, diarrhea, acid reflux, things that I had never had before.
Hmm.
I'd had them when I had a stomach bug, but not consistently.
Right.
Um, and it was attributed to I had changed the medication that I was taking, and it could have like a stomach upset as a side effect. So it was attributed to that maybe, or again, maybe stress or anxiety, PMS, those kinds of things.
Hmm.
So I let it go and it seemed to get a little bit better. But I kept feeling unwell, just tired, and the stomach pain kept continuing.
Hmm.
So I went back to the doctor. They did blood work again, tested for mono. It wasn't mono. I knew it wasn't mono.
Hmm.
I didn't feel like it was mono. But they tested for that a couple of times, and some things were off, but they weren't off enough.
Like what, for instance?
My white blood cell count was really low, and it got lower from March of 2019, and then it was tested again in August of 2019, and it got lower by about
Hmm.
half.
Hmm.
But no one really commented on it, so I didn't think anything of it.
Hmm.
I figured if it was something to be concerned about, they'd let me know.
Hmm.
But then in the fall of 2019, the stomach pain started getting worse. And instead of just being occasionally in the middle of the night, it would start and it would last for maybe 5 to 7 days a month. And it was so bad, it would make me throw up in the middle of the night. I couldn't sleep. I was putting like heating pads on my stomach to try to alleviate the pain. Um, and nothing was really helping. So I called the doctor again, and I had seen the nurse practitioner when I had gone in the last 2 times, but this time I didn't even get in the door. I just contacted them or communicated with them via phone and email, and they prescribed an antacid. They said to try it for 2 weeks. So I did. And I
Did
had
that
been
help
losing a
it?
lot of weight, not enough to make a real difference.
Hmm.
And I had lost maybe like 25 to 30 pounds, but I hadn't been eating for like that week when I had the stomach pain. I
Right.
couldn't eat anything but like dry crackers.
Wow.
So I was like, well, I've lost weight, but I also haven't been eating. So, maybe it's that. And I always, exercised. I worked out. I went to the gym. I was a runner. So I'm like, and I work out and I haven't been eating. So I'm not
Right.
fueling properly.
Right.
After the 2 weeks was up, I was still having the stomach pain to the same degree.
Hmm.
So I called back and they said to continue for 2 more weeks with antacid. So I did. And now it was getting into the holidays in 2019. And I didn't feel great, but I was like, well, they said this is what it is. I still hadn't been able to get in and see somebody.
Hmm.
So
When do you start
I
to worry, Heidi, that this is not gas or antacid?
I was starting to worry at this point. Like I was very worried. And I said to people like, what if it's cancer? And they were like, no, it's not. Your doctor would know, or,
What made you
pain would
say
be so
that?
bad.
What made you say, what if it's cancer?
I have a family history of cancer. My grandfather had lymphoma. My mom had breast cancer. So there's a family history there. And it was like an out of the normal kind of pain for me, like the stomach pain. It didn't seem normal. And I knew what was normal for my body, and I had never experienced this before. And it was so painful and so uncomfortable. And then towards the end of January, no, it was February, early February. I had gone to the gym, and later that day, like the whole side of my neck swelled up, like not just a little lymph node, like massively swollen, like Quasimodo.
Wow.
Just
for no reason.
Like no reason. So I called the doctor. I told my husband I was worried, like that's not normal.
Right.
And I called the doctor, and they said, what were you doing prior to it? I said I was at the gym. And then they said, oh, well, maybe you pulled a muscle. So they gave me a muscle relaxer, which I took, and it didn't help. It just made me sleepy.
Did it make, what helped the swelling to go down?
Just time, really.
Wow.
Over time, the swelling went down, but it didn't ever go down completely. And so after it was only a few days with the muscle relaxers, I called the doctor back, and they were like, well, there's a new nurse practitioner. She could see you. And I was like, yes, please. I want to be seen.
Right.
So now it's almost a year to my original appointment. We're coming up on that. We're also coming up on like COVID.
Right.
So I did go into the doctor. Finally, I saw this new nurse practitioner who was wonderful. And she looked at it and she said, I'm not super concerned, but let's order a CT scan just to see.
Of your neck?
Okay. And this was the first time anyone had ever offered to do any kind of additional testing. So I went a couple of days later to have that done. And finally, I got to talk to my doctor, because I'd only been seeing the nurse practitioners up until this point. And he called me and said that the CT scan was suspicious, but they couldn't really diagnose anything off of it. So, I give him credit. When he got that information, I did get in the very next day to see an ear, nose, and throat specialist. So he got me a referral quickly.
And so who does he refer you? Who does he refer you to at that point?
He referred me to an ENT because it was in my neck. And then that person did a fine needle biopsy. It came back a week later as suspicious, but inconclusive. Wow. So then they did a core biopsy. It came back another week later as suspicious, but inconclusive.
Wow. Hold that thought.
Yeah.
We're going to take a break here, but when we come back, we're going to have more of Heidi's story of how she found cancer in her body. And we're talking about the importance of self-advocating and making sure that if you don't get the right answers from your doctors, from your healthcare professionals, that you stay the course. Stay the course. Stay on point, everybody. We're back right after this. Welcome back, everybody, to the OPT Network. Our guest this morning is Heidi Richard. We're sharing her story because her story is many of our stories where we go to the doctor and we have symptoms and they really just don't know what the symptoms are or what to test for. But her persistence may have been the thing that saved her life. Heidi, so before we went to break, they send you to a specialist, and it's just really true. Your persistence probably saved your life.
It probably did. Yeah. I was incredibly persistent at this point. I was like a dog with a bone.
Right. So the specialist is telling you it's probably nothing. And quite frankly, we want to hear it's probably nothing.
Of course. I absolutely wanted to hear that and believe that.
Right. But in your in your inward knowing, something is not right.
Absolutely.
So he does the second biopsy and it's still suspicious, but they still don't have any answers.
Yes.
Okay, so how do they start drilling down to find out what the real problem is?
So they did a surgical biopsy and took out the lymph nodes in that area. And this was
Wow.
the same week that everything shut down in March due to COVID, that first weekend in 2020. It was then. So I couldn't have anybody come into the hospital with me. I was by myself. I'm trying to, emotionally handle this. And it was from that surgery that it came back that it was cancerous.
Wow. So why did he decide to take some of the lymph nodes? But did he do that because of the swelling?
He did that because of the swelling. Yeah.
Wow. Okay. So he removes some of the lymph nodes and then they test them.
Yes.
Okay. And so when they come back cancerous, what does the doctor say about all of the almost year long worth of symptoms that you had that didn't have an answer?
So the specialist I saw, he didn't have the best bedside manner. He was just very blunt. And he was like, this is what it is. And I'm going to refer you to an oncologist. And that was kind of the end of my discussion with him.
Really?
Yeah. And I actually found out, you know how you get the alerts online about like test results and things? I got the results via email before the doctor called me.
Oh, wow.
So I called.
So you're sitting with that at home on your phone. And what do the results say?
The results said that it was likely lymphoma.
Okay.
And that they recommended further imaging. And it was after hours. I called the doctor's office, the specialist's office, and said I needed to speak to the doctor. And the receptionist said, no, you can't. It's after hours. And I said, well, I just got an email of test results that said I had cancer. And I need to talk to somebody now. And I don't know if it was the tone of my voice or the way I spoke to her, but she got him to call me.
And so what does he say when he calls you?
He said that it was probably lymphoma and that he was going to have an oncologist call me the next day. And that was the last I heard from him. I got passed off to oncology and that was that.
Wow. And so when you get to oncology, and I mean, because of your family history, you sort of know a little bit about lymphoma, but I mean, is your mind at this point racing saying, okay, what is this really?
Oh, absolutely. I was terrified. And at this point, I'd been dismissed by so many medical professionals that I was finding it really hard to trust people because so many people had, said one thing and ended up being another, that it eroded my trust in the system. And I'd just been dismissed or kind of perceived as being a hypochondriac.
Wow.
That I felt like people were judging me. And so it was hard for me to say something now because I was feeling judged, but I had to say something because, it was my life.
Right. So
I went to the oncologist and I guess the original testing of the lymph nodes showed that it was follicular lymphoma, which is like a low grade, slow growing lymphoma. But if it's left untreated, it can turn into diffuse large B-cell lymphoma, which is a more aggressive cancer. So they wanted to do a PET scan to find out, how far this had gone.
Okay.
So when they did the PET scan, it came back that it had transformed into the more aggressive lymphoma because it had gone untreated for so long. And it was at that point in my abdomen, which is why I'd been having the stomach pain.
Wow.
It was in my neck where the lymph nodes were. It was in my lungs, sternum, bone marrow, my spleen.
So now it's traveled through your body.
Absolutely. It was everywhere because, your lymph system is systemic. So
right.
Just like blood, it travels throughout.
And so does the oncologist at that time, when he's explaining to you and you're telling him about this year-long pleading with doctors to try to find out, what does he say to you?
They were the first people that I finally felt like somebody was listening to me. Like they listened, they were honest, they answered my questions. They said right away from the beginning, there's no such thing as a stupid question. You can ask us anything. It was the first time that I felt like somebody was finally listening and taking me seriously.
Mm-hmm. And then what do they tell you the prognosis will be and the course of treatment?
So they said, well, it was interesting because it was when it was just the slow growing lymphoma, when they thought it was just that, that's actually considered an incurable lymphoma. It's more managed like a chronic illness,
Mm-hmm.
but people can live with it for a very long time. But once it had transformed to the more aggressive lymphoma, that type is actually curable because they can use more aggressive medication on it. So, I mean, it was bad that it transformed, but it was good in a way too, because they
Mm-hmm.
could fully eradicate it,
Mm-hmm.
where before they could just manage it.
Mm-hmm. But
So it's kind of the silver lining.
right. And so, but at some point you would have to have a bone marrow transplant.
Yeah, I started out having outpatient chemo, um, one infusion every 3 to 4 weeks. And I did that 3 months. And then they did another scan and it showed that it had only partially worked.
Mm.
So it had worked on the original lymphoma, but not on the more aggressive one that it had transformed into. So at that point, I switched to a more aggressive chemo that involved being in the hospital for a week, a month, because they gave it to you for 5 days straight and they had to monitor your heart symptoms
Wow.
for the entire time because it can affect your heart function. So I did that all through the late summer and fall and into the winter of 2020.
Mm-hmm.
And I knew at that point that I was going to have a bone marrow transplant because the first line of treatment hadn't eradicated it.
Mm-hmm.
So I did that in the fall of 2020. I was in remission, but I
Mm-hmm.
continued with that treatment. And then around Thanksgiving, maybe like the week after Thanksgiving, they harvested my own bone marrow I did shots for 10 days to cause it to grow
Wow.
like more bone marrow.
Because I'm thinking, okay, now who are you going to enlist for the bone marrow? But they
Yes.
harvested your own.
Yeah, they swabbed my cheek just in case they needed to use the bone marrow registry. And one thing to know about the bone marrow registry that I think it's super important for people to know is when I went to get swabbed, the nurse that came in said, "Oh, we're so glad you're white and of European descent," because white people of European descent are disproportionately represented on the bone marrow registry. There are not enough people of color. There are not enough mixed race donors. So anybody that comes from a mixed race background, especially, even if you had relatives from like Asia and Europe, the likelihood of you finding a bone marrow match is so low compared to someone who's Caucasian of European descent.
Wow. Hold that thought. Hold that thought. Let's take a break here. But when we come back, I really want to sit with that because not only are people of color disproportionately represented when it comes to not having resources to get transplants, we're also not donors. And so we really need to talk about that. Stay on point, everybody. We're back after this. Welcome back, everybody, to the OPT Network. This morning, we're talking about perseverance and we're talking about being able to advocate for yourself. And that advocation may be the thing that saves your life as it did with Heidi Richard. So Heidi, before we went to break, I think this is so important because our show has really talked about over the years, people being donors. And people of color are not going into places to donate blood or even marrow so that there is a chance for somebody of color to be able to have a match. And that prolongs the process. And the point that you're bringing up, I think, is so powerful. Being that you're a white woman, they're telling you, no, don't worry.
Yeah.
We're going to find a match for you because that's how many donors are available.
Yeah. And they said that they were like, "Oh, don't worry. You don't have anything to worry about as a, white female of European descent, you're going to be fine.
Wow.
But it's not the same for people of color.
Wow.
And I don't know if people realize that. I know Be the Match, the National Registry, they do a lot of advocacy for that, trying to get people, especially of like different mixed races, to come out, because if somebody was, had one family member from Africa and one from China, you would need to have a donor that comes from those regions, both of those regions, in order to be successful.
But they ultimately harvest your own marrow. And so you're able to use your own marrow.
It took 10 hours.
Wow.
And it's the same process they would use if you were a donor. It's relatively painless. They like hook you up to the machine and it takes your blood. It centrifuges out the marrow cells and then it puts your blood back.
Wow.
So it was fascinating process.
And so one of the things that you did was you ran the Boston Marathon, which is, of course, in your hometown or near your hometown. So was that your first marathon?
It was my second. I ran Chicago in 2018.
And so the fact that you had gone through all of this and you survived, was that like the catalyst for running?
It was. So I ran the Chicago Marathon in 2018 and it was fun, but it was painful. And so I said to my husband afterwards that I'm never going to run another marathon. This was not something that I want to do again. But I said, unless somebody gives me a bib for the Boston Marathon and it's for a charity that really speaks to my heart, thinking like that's never going to happen. Right. And then this past January, I got a call from Detect Together, which is a local cancer charity in Westborough, Massachusetts. And their mission is to go into colleges, high schools, and workplaces and teach people about the early warning signs of cancer, specifically cancers that are more common in certain fields. Like, for example, firefighters are more likely to get a certain type of cancer. So they educate firefighters on what to look for. And they advocate for people knowing about the yearly screenings that are available to them, how to get them, how to find a doctor. And that was kind of what I've been trying to tell people since I had to advocate for myself so much. So here's this charity offering me this fundraising bib. So I decided to do it. I knew that I was going to be a lot slower than I had been in 2018 when I did Chicago, but I did it. And the charity was great. They were so supportive. I ended up raising about $13,500 for them.
How many miles is the marathon?
12. Yeah.
How many miles?
26.2.
26.
Yep. And there were 12 runners on our team. There's 30,000 runners in the Boston Marathon in all.
Wow.
A lot of runners in Boston are charity runners. That's a big part of the marathon, people for different charities. So we ran under the official Boston Marathon charity teams, they were so supportive and amazing. And when I was out there, I kept thinking there were so many times that I wanted to quit. It was cold and it was windy. And it wasn't comfortable. I had blisters on my feet and I wanted to quit. And I kept telling myself, you have done harder things than this. This is not the hardest thing you have done. It's not the hardest thing you will do. And I kept thinking about all the people that were counting on me and looking to me as somebody to kind of put the bookend on this chapter and say, I stood up for myself and I'm still able to do the things that I love.
Wow.
So when it got tough, I thought about those things and I just put one foot in front of the other. I ran the last 2 miles with a 70-year-old woman who was running her 20th marathon.
Wow.
Yeah. She was from Wellesley, Massachusetts. And she was awesome. I told her my story. She started crying. And then in Boston, like the thing people talk about, the way the race ends is you take a right on Hereford Street and a left on Boylston. Okay. And then the finish line is right there. And we got to Hereford and that's like, everybody knows once you get to Hereford, like you're done.
That's it. You're home.
Yeah. And the woman said, she was like, we were staying together and she was like, now you go ahead and you go get it. And she was awesome. And I loved her. And if it wasn't for her, I don't know if I would have enjoyed the last couple miles because it took me 6.5 hours, which is long for a marathon. But she was awesome and she lifted my spirits.
But it doesn't matter how long it takes to run the race. It matters, though, that you did finish, and you finished for this charity, and for,
I did.
That you had the strength and the perseverance to finish. And so did you ever think in your wildest dream that your story of advocacy, self-advocacy, would get so much attention?
No, not at all. I never thought when I submitted that essay to Boston newspaper, I just thought, oh, this is fun. It'll pop up on their website and that's cool. And the fact that it got so much attention and it resonated with so many people really blew my mind. I got so many messages from people that like the same thing had happened to them, or even I'm meeting a girl for coffee on Saturday who told me she's 27 and she's been trying to get doctors to listen to her for 2 years now. And she wanted to know if she could meet up with me and I could kind of help her with what to say at her appointment.
Wow.
So I'm glad that what I went through has been able to help people. I'm glad that it, has a purpose.
Sure. And so the prognosis going forward, you're in remission now. What are they expecting over the long term?
So in September, it'll be 2 years that I'll be in remission. And 2 years is a big milestone with my type of cancer, that once you get to that point, your risk of recurrence is drastically lower.
Okay.
Because of some of the treatments that I had, I do have a higher risk of breast cancer in 10 to 15 years. But the option was like, either we do nothing now and that's it, or we worry about it in 10 to 15 years. So I went with, let's worry about it in 10 to 15 years, hoping that medical technology has, progressed enough by that point to make things easier.
Do you have a peace right now with, knowing, in 10 to 15 years, what kind of...
I do, because at the time, I just wanted to see my kids grow up, and 10 to 15 years felt phenomenally far in the future. I was just focusing on the day in front of me at that point and what was going to happen next, and putting one foot in front of the other, just like I did during the marathon, and just kind of moving from step to step. So like 10 to 15 years in the future is what it is.
Yeah. And all we really have is today anyway, right?
Absolutely. I mean, anything can happen from minute to minute in life. You don't know.
Yeah.
And the way my oncologist said it was that, new things are being approved every week in the field of oncology. So who knows what they're going to be doing in 10 to 15 years from now.
Absolutely. Heidi, thank you so much for the courage to not quit on yourself and the courage to share your story. It's going to affect and bless many, many people. Thank you so much.
Thank you.
Indeed. Heidi Richard has been our guest this morning, everybody. Stay on point. We're back right after this.